All this is pediatrician Dr. Dina Kulik. Dr. Kulik, great to see you.
You too.
So, Dr. Kulik, I want to get your thoughts on what Dr. Kieran Moore was saying about this flu season. He says that he believes it may have peaked. Is that what you're seeing?
I wish I agreed. I'm happy that people are testing with less positivity, and the admissions seem to be with children that don't have influenza at the same time. However, what I've seen in our clinic at Kid Crew is certainly there's many cases of influenza. Perhaps these kids are not getting admitted, which is great news, but there's still very high levels of RSV and COVID as well. And many of our patients that have been hospitalized are testing positive for multiple viruses. So not just influenza, but influenza and RSV, or RSV and COVID. Those sorts of situations has led a lot of kids to get very sick.
So what does this mean in terms of what you've seen in children's hospitals as well, and the kinds of cases that are coming in?
There's definitely lots and lots of children coming to clinic as well as going to hospital that have flu-like symptoms, respiratory compromise in some cases where children are requiring oxygen or even more respiratory support. The vast majority of kids are having normal viral flu symptoms, fevers, coughs, colds, stomach flus. However, some children are getting very sick and requiring respiratory support.
Are you still seeing parents having difficulty locating bottles of Tylenol or ibuprofen for their children, and really coming into you to seek that kind of treatment?
Yeah, absolutely. There's still some shortages. It's better. It seems to be better in the last few weeks. To my eyes, I know of several pharmacies that have had stock that our patients have had success going to, but there are still some issues getting some medicines, particularly for the younger babies, particularly liquid forms of acetaminophen and ibuprofen, but there do seem to be more in stock in the last couple of weeks.
Now, Dr. Kieran Moore was also saying he expects in early January to see an uptick in COVID-19 cases again in the province. Meantime, we do know that parents can start booking appointments for the kids 5 to 11 for the new bivalent booster that's available in Canada for that age group. Can you remind us what the guidelines are for that booster if children have completed their primary series?
Yeah, so if children have had two vaccines, 6 months later, they are eligible to get a bivalent booster, which would cover, importantly, for BA4 and BA5, which are prominent Omicron strains that are still circulating and have been for a number of months. Most of us recommend that our patients get this booster regardless of health status, but particularly children that are most vulnerable, that have weakened immune systems or other risk factors, are certainly very much encouraged to get this vaccine.
And just finally, Doctor, because the holiday season is upon us and there are a lot of family gatherings that are planned, larger gatherings than we've seen in past pandemic years, what are your recommendations, and how can parents be vigilant about keeping their kids healthy and safe?
This is going to be a hard season for sure. People are very eager to get together again, as they should be. We've been missing out on time spent with our loved ones. However, I would caution you that there is a lot of circulating virus around, not just influenza, RSV, COVID, lots of things going around. So I would strongly suggest to stay home if you're sick. Even if it's a very minor illness, it is likely one of those three illnesses. And if there's anyone at your gatherings, at your holiday festivities that has any risk factors, whether they're young babies or the elderly or anyone with any risk factors, respiratory or cardiac or otherwise, I would be very conscious that those people are at highest risk of getting these illnesses and having severe illness from these typically very minor viral infections.
All right, Dr. and pediatrician Dina Kulik joining us on this. Thank you so much.
You're welcome.